My name is Dr. Carl Nunziato, and I'm presenting NPO time and aspiration risk in pediatric orthopedic trauma patients on behalf of my co-authors listed here. We hail from the Dell Medical School at the University of Texas at Austin and have no disclosures to report. Current preoperative fasting recommendations for orthopedic trauma patients have largely evolved from expert opinion. This is not a benign process, as prolonged fasting has been associated with increased anxiety, postoperative nausea, and prolonged inflammatory response. Recent literature supports more liberal fasting regimens in certain populations. Our aim was to identify factors associated with perioperative aspiration in isolated pediatric orthopedic trauma patients. To that end, we designed a retrospective chart review based out of a large urban level 1 pediatric trauma center over an 8-year period. We included any patient less than 18 years of age who underwent surgery for isolated orthopedic injury within 24 hours of admission. We excluded any patient with polytrauma or who was admitted directly to the ICU. Our primary outcome was aspiration. However, since this is an exceedingly rare event, we also looked at suspected aspiration, which we defined based on hospital practices as any patient who had a desaturation below 90% SpO2 in the perioperative period, as well as any patient who had a postoperative chest radiograph order. Our secondary outcomes were length of stay, 30-day readmission rate, as well as postoperative nausea and vomiting. Our explanatory variables were preoperative NPO time broken into 2-hour categories, as well as induction method and device, preoperative nausea vomiting, the American Society of Anesthesiology physical classification status, mechanism of injury, and standard patient demographics. Our cohort totaled 1,642 patients, of which there were 0 documented aspirations. However, 37 patients, or 2.3% of the cohort, did meet criteria for suspected aspiration. Within that group, we found no association between NPO category, length of stay, readmission rate, or postoperative nausea and vomiting. We did find, after multivariable analysis, that risk of suspected aspiration was significantly associated with higher ASA classification status, as well as lower extremity injury, which we considered a proxy for higher mechanism injuries. There are several limitations to this retrospective chart review, mainly that this was a retrospective study of an exceedingly rare event, and there was no uniform protocol for intubation and extubation in our procedure. We're also relying on the quality of the perioperative documentation and unfortunately lacked nuance of fasting status beyond NPO time. Fortunately, aspirations remain a rare event. However, they may be more likely in patients with higher mechanism injury as well as those who are more ill at baseline. NPO times do not correlate with risk of aspiration or other adverse outcomes in our cohort. With more research, fasting requirements could possibly relax. Thank you again for the opportunity to present. And for further information, please feel free to reach out with the information below. Thank you.